Hello, everyone, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a quick few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation will be recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice.
Hello, everyone. Thanks for joining us today for our live question and answer session on the topic of virtual assistants. I'm Dr. Si Chen. I am the Physician Director of Practice Sustainability here at the AMA, and I'm joined by Dr. Carolyn Francavilla. Thank you, Dr. Francavilla, for joining us today. The presentation you gave was an excellent overview on virtual assistants the last time we saw you. So if you don't mind, if you could remind our audience about your background and your practice so that they have a little bit of context for our Q&A.
Sure. Well, thank you for having me. And I'm very excited to talk more about virtual assistants because it has very much transformed my practice. So I'm Dr. Carolyn Francavilla. I'm a family physician and obesity specialist in Denver, Colorado. I have my own independent practice with 4 physicians and 1 nurse practitioner. And I'm the chair of the AMA's private practice physician section. Virtual assistants are something we implemented about 2 years ago in our practice and have seen it dramatically improve our efficiency, our ability to serve our patients, frustration from our staff, our clinicians, and it was a financial decision that made a lot of sense for our practice as well to be able to continue offering the level of care we wanted to in our practice in a climate where there is decreasing reimbursements and inflation. So a really helpful solution to the practice. And I think we're going to dive into questions today based on, hopefully most of you checked out the webinar, but that gives you a little context with my experience, and we'll see what questions you have to implement virtual assistants for your practices.
Great. For our audience members, just please go ahead and type in your questions in the Q&A box, and we'll get to as many as we can. But kicking things off, I wanted to talk a little bit about, how you went through the hiring process. I know that there are kind of 2 ways from your last presentation to do this. We could hire ourselves, through independent avenues, or we could go through a management agency for virtual assistants. So I think first off, if a doc doesn't want to go through the hassle of recruiting independently, how do you choose or how do you evaluate a good virtual assistant management agency?
Yeah. So like you said, there's really 2 options. You can recruit someone directly to work virtually, and they may be in the US or they may be working elsewhere in the world, or you can use a company to help facilitate that. And it seems like the amount of companies that are offering those services has just skyrocketed in the last few months alone. So there are lots of options there. Like anything, you want to sort of evaluate if it's a good fit for your practice and look at any sort of terms and conditions. A lot of these do seem to be physician owned. So I think that's kind of cool, a way to support physician entrepreneurs and people who more likely are going to understand the needs that we have as well as some of our limitations. But you want to know what that contract is going to look like. So they will have some sort of contract. You may have a BAA with them that, puts a little bit of responsibility on them for protecting privacy and other things as well. I think that's an important feature that most people are looking for when they're outsourcing and working with an agency to find their medical assistants. You want to know what their process is for finding these virtual assistants. Do they do any training? Most will offer some basic training on how to use EHRs, on HIPAA. So what training are their virtual assistants getting? And then what's the pay setup for the virtual assistants? So the sort of middlemen, the agencies are certainly keeping an amount, to run their business, but you want to make sure that they are paying the virtual assistants an appropriate living wage, or hopefully more, in their country where they're working, if it's a virtual assistant that's out of the US. So those are some things that you might consider. And a lot of these are very similar. They're going to have different rates. They may have different countries that they work with as well for virtual assistants. So a common place is the Philippines, but there are virtual assistants coming from all over the world. You may have unique needs in your practice. So maybe you have a practice that has a high amount of Spanish-speaking patients, or patients with another language that's common in your community. Having a virtual assistant that has that language as their native language may be a huge benefit, maybe a huge edge and a convenience to your practice. So those may be factors as well, is where are these virtual assistants located? And is that some sort of value to your practice? Again, if you had a virtual assistant whose first language is Spanish, that could be a huge asset to a practice with a lot of Spanish speaking patients. So those would all be different things to consider. And then, like any contract, what's the exit? Most of these are going to have some sort of non-solicitation, meaning you can't just hire through the virtual assistant company and then end up making your virtual assistant an independent contractor with you, for example. How long is the contract? Is it for 6 months? Is it for a year? If you don't like the virtual assistant that they helped you find, how do they fix that, right? Will they find you another one? Will the contract be voided? Those sorts of things. So those would be some of the things that you would want to consider, just like any sort of contract you would have for another service with your practice.
Well, thank you for going through all that. I think you've outlined some basics that you should definitely evaluate, like the BAA for, especially for privacy issues, HIPAA compliance, et cetera. Pay, how folks get paid. But also, I think you've outlined beautifully that I think folks need to see what they can tailor to their own practices. So I think those are two key critical things in evaluation for sure.
Yeah, and I'll add to that. What do they have a history of training virtual assistants or recruiting virtual assistants to do? When I was looking at different agencies, there were some that were more focused on, say, scheduling or surgery scheduling. Mm-hmm. I'm not a surgeon, so that wasn't a need that I had as much. We needed virtual assistants more for things like prior authorizations, sorting faxes, dealing with pharmacies. And so the company we worked with recruited mostly people who were trained as RNs or nurses in the Philippines. And so that was a better fit for the services we needed in our clinic.
Gotcha. So if let's say I didn't think that any of the management agencies or the companies were a good fit for me, and I wanted to go out and try to directly hire, like, what are the ways that somebody could actually do that?
Yeah, so there's websites that are available online. A popular one is onlinejobs.ph, so onlinejobs.philippines. And that is largely virtual assistants who are based in the Philippines, though sometimes there are people on that site who are based elsewhere in the world. But you could use other job finding sites as well. They're not often limited to the US. So or again, you might hire a virtual assistant that is in the US. So you could use things like Indeed or other job hiring sites and just hire people directly like you would for your office. And we did that for the third VA we hired someone from onlinejobs.ph and just did a sort of a normal recruiting process for that. We had a job description. We had questions that we asked in an interview, and interviewed a few people and found someone who was incredibly competent in the skill set we were looking for, actually more knowledgeable than anyone I'd interviewed in the US for the position. So it was a great find for us to be able to directly look for that person.
That's great. I think switching gears a little bit, like I think we've gotten two ways of really trying to find a virtual assistant, but I think the next step is trying to integrate them into your practice. So I think the first thing I want to ask is, well, in searching for the virtual assistant the first time, like going through the management agency, how long did it take you to find an appropriate virtual assistant and onboard them and integrate them into your practice with the agency first? And then I'll ask you about the one that you found directly as well.
Yeah, I would say with the agency, I think the process, from when we reached out and selected the company we wanted to work with to having a virtual assistant was 3, maybe 4 weeks to sort of choose the company. Then they sort of found people in their applicant pool that they thought would be a match with us, and then offered 3 people for us to interview that we could select from. And then the company that I worked with, and again, I think most of them do this, have done basic training on things like, and I'm so sorry, my dogs might start barking here. Someone just came to the door. But they were already trained on like HIPAA and how to use basically an EHR. Both had a lot of experience in healthcare as virtual assistants already. So training them, we started with simple tasks. So the most immediate pressing need that was easy to do virtually and that we had staff members in our state do before virtually was sorting our fax inbox. In primary care, we get a lot of communication. We get notes from every specialist. We get pharmacy refills. We get x-ray reports. We get so much in our inbox. And so that was where we started. We didn't start having them do every single task. So once they were able to demonstrate competence and medical knowledge that was appropriate for that task, then we started layering on other tasks, like, calling pharmacies for issues that we were having. Then we started layering on, more tasks in terms of like helping with triaging voicemails and messages from patients, and then helping with scheduling. So we started with simple tasks like you might with an in-person employee, make sure that they're demonstrating competence at that before adding additional skills. And then we already had, training materials that we used for our in-person staff. So if you don't have that, that's a good place to start. And I can talk about how to develop those if your practice doesn't have those. And then in my case, I did have an office manager. So she was the point person. She did a lot of the administrative training. And then one thing I always like to do with the new employee is have them shadow me, even if it's just for a little bit, so they can learn a little bit about how we interact with patients, the culture of our clinic, how we talk about things, some of the language we use. So I think that's an important opportunity that can be helpful and also build a little bit of team building, since these employees are virtual and you may not spend very much time face-to-face with them, but shadowing virtually can be a helpful tool as well. Did that answer your question, C? I'm sure we could go on a little bit more about that.
Yeah, I think so. I think you've touched upon a couple of points that I wanted to ask you about, actually. So, I think you talked about all the different tasks that the virtual assistant can do for you. Some of the things that you can offload. Like in my mind, I wasn't able to use virtual assistants in our clinic when I was practicing. So, we had folks that were in office, in house, if you will. How does the virtual assistant sort of interact with you on sort of a day, like a clinic day? How do they interact with the in-office staff? Can you sort of take me through what a typical
our office manager has the most direct communication with our virtual assistant. So she's the point person if they're having issues with, say, internet connectivity, or they have a doctor's appointment or something else, like those sort of staff management issues, just like she is for our in-person medical assistants. So they definitely have the most direct communication, but we predominantly communicate through our EHR. We also have a messaging system that's HIPAA compliant that we use with our patients. And so we will interact with them as well. So in our EHR, that's just sending a message to the virtual assistant. So in clinic, sometimes we'll have an issue that's come up. A patient was having an issue with the referral, or maybe a challenge getting their medication from the pharmacy. And I will actually, while I'm just talking to the patient, message my virtual assistant in the EHR, and often they're able to resolve the issue before the patient has even left. So then I get a message back in the EHR saying, talk to the pharmacy, they'll be able to pick up the medication later today. So that's an example of how we communicate. we do have a patient messaging system that we use as well, where patients can communicate with us asynchronously. And in that system, we have the ability to tag our virtual assistants. So if a patient, say, reaches out to me and they need an appointment, I can tag the virtual assistant and tell them where I'd like the person put on the schedule, or ask the virtual assistant to reach out to the patient to help with scheduling. So essentially just messaging through the EHR or other computer system where we can tag the virtual assistants and assign them tasks is our main form of communication. And then early on, we did team meetings with our virtual assistants. Once they were really trained and on board, we really don't do as many of those. But for a while, we really did, a weekly team meeting where the virtual assistants could bring us challenges they were having. The medical assistants could bring issues they were having and see if that was something that the virtual assistants could assist with. And that was a good process in the beginning to just have a meeting like you would with your in-person staff.
Great. We had a question from the audience, which I think fits in with some of these things. I think you've talked a lot about sort of leveraging technology to communicate with the virtual assistants. But this question specifically is, well, we have the virtual assistants, but are there any things that you have automated? Do you have any technology sort of automate some of these processes for you, or some of these tasks for you that may not necessarily overlap with the virtual assistants, but may help you in other ways?
Yeah, I'll admit to being a little less interested in AI myself. So that would be potentially an application of AI. I still, prefer to make sure, there's like hallucinations and stuff with AI. So if people are talking about using AI for prior authorizations, I don't trust that AI is not going to put the wrong diagnosis down to get the prior authorization approved based on what I've seen. So we've relied mostly on real people. I guess it depends on what your definition of automation is. So I think creating protocols are really helpful. So prior authorizations are something that I think most of us are struggling with. For me as an obesity physician, those are a huge burden right now with our newer medications, which always require a prior authorization. So we did just a lot of training with our virtual assistants of how to do those, where to look in the note, where things would always be recorded so that they knew where to go for that information. For example, one thing on the prior authorizations for those medications is often, was the patient doing a comprehensive lifestyle program with diet and exercise? And sometimes that wasn't clear to our virtual assistants in our note if we were doing that or not. And so it was easy. It's we're always doing that. That is part of our regular standard care. So you can always check yes to that box. So I think just having protocols, having things clear for your virtual assistants is it's not quite an automation, but it's using that in a streamlined way. And then, built into your EHR often are lots of automations that you're not really thinking about, right? So, for example, when we record a vaccine, that's automatically going to our state registry. So automations, like that, where, we have automations for reminder calls, automations for, we can create at the end of our appointment a reminder to the patient of when their next appointment should be, when they should schedule. So I think those are some of the automations that maybe we're taking for granted in our EHR that we all want to utilize as well. We probably shouldn't be calling people about reminder for their appointment. We can have that as an automation. Paperwork is another automation. This is separate from virtual assistants, but our paperwork is automatically sent with the appropriate encounter type. So if someone's for a follow-up in primary care, we're always doing a PHQ-9, a depression screen. So that's automatically included in the paperwork that the patient gets electronically. And then you can use your virtual assistant to double check a day or two before that everyone has completed the paperwork. And if not, send it again, or possibly call or text the patient to remind them to do it. So those are, I think, are some of the ways we're using automations where we're okay, patients can schedule online. When they schedule online, they get the appropriate paperwork for that appointment. And then we're using the virtual assistants to double check things, right? Is that that schedule that was done sort of automatically online by the patient at the right time, right? Is it an appropriate time? Did they schedule the right type of appointment? Did they get the right paperwork filled out? So using the virtual assistants as sort of a double check for some of those automations, I think, can be helpful as well.
Right. I think you talked a little bit about reminder texts, if you will, or calls. So you're having your virtual assistants do those, but they're triggered by the system.
So ours are automatic. So,
Oh,
when
okay.
someone books an appointment, our computer system is set up that they get a reminder, I think like at a week and at 24 hours before their appointment. Maybe it's also an hour before their appointment. So that's all automated in our EHR. And then when they're first scheduling the appointment, the appropriate paperwork for them to fill out to say update their insurance card, do a depression screen. If it's a weight appointment, we have special paperwork for that. So all of that is triggered if the patient schedules the right appointment type in our computer system. And then we're using the virtual assistant to double check that, right? To make sure, that it's not a new patient that's scheduled in an existing patient slot, that the paperwork actually is complete, that we actually did get their insurance card. But the first steps are automated. I think it's hard to rely completely on automation, right? You're going to be frustrated when your patient doesn't follow the directions. And so using virtual assistants to sort of follow through on those tasks to make sure they're done.
Yeah, I think that's a great point. I think, at the AMA, we talk about augmented intelligence instead of artificial intelligence. And I think that's a key point where we're working hand in hand with the technology to try to make things better for us and for our patients. So I think that's a great point, that it's not just, hey, we're just letting automation do everything. We're still double checking, triple checking, and having that personal touch point.
Yeah. And again, it's ultimately our responsibility at the end of the day, whether it's because it's a medical decision or medical information that we're providing. Say, again, in the case of prior authorization, I don't want a medication getting approved for the wrong reason, and ultimately that coming back to be a problem for myself or my patient. And then, an example like scheduling, I think self-scheduling makes a lot of sense for patients. It's what I want as a patient myself. I want to be able to schedule an appointment, over my lunch break, which might be when the doctor's office is closed and they're not answering the phone, or at 10 o'clock at night when I'm thinking about the fact that I need to schedule an appointment for myself or kids. So I find that, letting people self-schedule and have some automations there is helpful. But if you just let that go without some augmentation, like you said, some supervision, then it's going to turn out to be probably a bit of a disaster, because you'll have patients that are booking a virtual appointment for a pap smear. We've had that happen in our clinic. We're like, we're so sorry, we don't have that technology yet. We can't do your pap smear, and this appointment's only a virtual slot. Can we reschedule you, right? So those are the things where you need I think a human kind of checking in to make sure some of those automations are working.
Right. I think that's the power of the virtual assistant, being that human touch. So how are your staff feeling about having, virtual assistants in the clinic with you guys?
We all love our virtual assistants. In many ways, there was this huge change that happened in most places in the US during COVID, most places in the world, right? And so we had a harder time, I think, like everyone else, recruiting and retaining staff. And some of the feedback, we hired largely pre-med students as our medical assistants at that point. A lot of the feedback we got from our in-person assistants was that they had a lot of really boring tasks that they didn't enjoy, like sorting the faxes, dealing with scheduling, just a lot of things. And it was also making it hard for them to keep up with some of the in-person tasks, doing EKGs, giving vaccines, blood draws, other things. And their day got really fragmented. And so by separating out some of those virtual administrative tasks and having people who are dedicated to doing them, they're incredibly efficient. Our virtual assistants aren't getting interrupted by someone who's coming in to check in. They're not getting interrupted by needing to do a blood draw or by a phone call. They can focus on those tasks and be more efficient. And then our in-person staff is able to do things that are a higher skill level and more rewarding to them. Again, like the blood draws, the EKGs, talking with patients. And so I think there's been a huge improvement in job satisfaction, because people don't feel like they're pulled too many different directions, and they're doing jobs in office that they enjoy more. And we really view them as part of our team. So, we worry about them when they take a sick day. We worry about them when their dad is sick. We give them little bonuses. We, celebrate when they have babies, all the things that you would do for your in-person staff. They really are, part of our team.
That's great. I hear all of the great things that virtual assistants can do for you. I guess one of the things is, well, there's probably some things that were hard. And so what were sort of the obstacles or hardships that the sort of the kinks that you had to go through in adopting
There
using
were some
virtual?
technology kinks with some of the technologies having a phone number in a different country or some of those logistic challenges. There was a little bit of tech challenges to overcome, but they were overall not that challenging. But those were bumps, that delayed things sometimes for days when we were onboarding someone, getting them actually linked up with the technology that we needed to be able to work together as a team. um, like if our virtual assistants are all in the Philippines. The weather there sounds like it gets crazy sometimes. So they struggle with tropical storms and floods. And so, sometimes our virtual assistants are not available because of all the things that can happen to us too. But, again, weather being one of the things that sometimes will knock out their internet connection. And there's not a whole ton they can do if they can't connect to the internet. And then I think I've heard from people, just depending on where your virtual assistants are located in the world, people have different practices around holidays, around time off. And so sometimes there can be cultural differences, cultural expectations that may be different that you may need to be aware of or be flexible around. So I think those would be, some of the things to consider and be prepared for. But overall, I'm knocking on wood here because, it's overall been a really wonderful process. Our virtual assistants have stuck with us long term, so we haven't had high turnover. They've been easy to work with and truly just a wonderful part of our team. So I would say, thus far, again, knocking on wood a little bit, less staffing challenges with our virtual assistants than our in-person employees.
Well, that's great. We did have a question about that onboarding. It sounds like the main issues were mainly technical and connectivity, that kind of thing. Were there any issues or challenges with training the virtual assistant? I know you mentioned that you train them kind of like you train in-staff.
Not really. I
in-office
mean,
staff.
again, our virtual assistants that we selected, we did interview them. So you want to ask questions to really understand their competence level. But the two that we have that work a little bit more as like virtual medical assistants are trained as RNs. One had worked internationally. So I felt like that was a good sign that she had not just been an RN in the Philippines, but actually had worked in another country as well. So she'd really seen medical care. She had a good foundation of knowledge of medicine going in. And then the other one had actually worked for a health insurance company doing prior authorizations on the other side. So had a really good understanding as well of the American healthcare system. And they both had been trained, again, by the company we hired them from. And then the virtual assistant that we hired independently also, she had worked for some sort of agency working with billing and coding in the US healthcare system and truly had a very, very good understanding of all of it, of the rules, how to chase down claims. So I think assessing, before you hire someone, really assessing their knowledge, asking questions like you would an in-person medical assistant, making sure that they understand the skills that you need them to do, but recognizing that there are people around the world who, are just as skilled as the people we're hiring here. And it was a really interesting experience. It really opened up my eye to the fact that, there are highly trained, highly skilled people throughout the world that can be a good part of our team. So
Right. And
I guess, not to be like, but it really has been such an overwhelmingly positive experience. I've heard from colleagues who have had virtual assistants that haven't met their needs. I suspect it's either not selecting the right person in the beginning, just like I'm sure you've all been through that experience with in-person employees where you hire someone and it turns out they just don't have the skills necessary for the job. And you have two choices. You can either train them on those skills, and if they really don't become competent at them, then you have to let that person go, whether they're an in-person or a virtual employee. So making sure that you think they have the right skill set before you hire them. And then you do have to train people. And that's something that, I have grown to appreciate more and more as I've had a practice for 10 years, that it's our job to train people. If someone is not doing their job right, usually it's a training issue. We did not do the right job in training or explaining or setting expectations. And so we have to revisit that if someone's not working out. And then if the person is still not working out, then we have to be okay with finding someone else. Just like in the real in person.
Yeah, yeah, definitely, definitely. So I think we're going to start to wrap up, but I do want to I do have a couple of other questions for you. Being a little bit forward-looking, what are some things that you aren't having your virtual assistants do now that you're thinking about? Hey, maybe this would be a good couple of tasks for us to sort of transition to them in the future.
Yeah, I mean, in the primary care and sort of preventive obesity medicine space, we did use a little bit of remote patient monitoring. We ultimately decided that wasn't something we wanted to do, but you could use a virtual assistant for remote patient monitoring or chronic care management. That would be a good application of those. You certainly could use them to help with meeting metrics, meeting data. We do a little bit of this, but pulling reports, seeing if your patients with diabetes have come in for an appointment in the last 3 months, might be an example in primary care. And in obesity medicine, coaching is become very popular. So you could possibly have them interface and do coaching. You could have them reviewing data. If people were submitting, again, this is like specific to my specialty, but if people were submitting data on how many calories they were eating or what their weight was, you could have the virtual assistant as the first stop to sort of triage things. And I think we could be using our virtual assistants more for triage in our current setup. We do not have our virtual assistants doing refills. We do all of those, but I think that you could have protocols for refills potentially for appropriately trained virtual assistants. So I encourage people, if they're thinking of transitioning or adding a virtual assistant, to write down all the jobs in the clinic. All the things have to get done, whether it's, cleaning the exam rooms, dealing with faxes, dealing with scheduling, dealing with referrals that are coming in, coming out, all the little tasks that are being accomplished in the clinic. And then sort of, circling, I like to do things on paper. I'm sure you could make this fancier on a spreadsheet if that's your style. But what are those things that a virtual assistant could do? And then start with the most obvious ones. If you're introducing a virtual assistant, again, for us, that was the fax inbox. It was unmanageable. It was pretty boring. It could have been automated, but the automation didn't work well. The automated system was inaccurate, right? We really needed someone who could look at it, make sure things were going to the right place. And so, look at everything that could be virtual, and you'll find a lot of tasks that can be, I think, in almost any practice. And then you can keep layering from there.
Okay. Well, I think we have one final question from the audience, an audience member. What's been your experience in the difference in cost between like an in-person employee versus a virtual?
Yeah, so this is going to vary a lot by where you're at in the United States. So I'm just outside of Denver, and Denver has set its own living minimum wage. And so entry level jobs really start in Denver at, I think, $21 an hour. So you can't hire someone less than that. Elsewhere in the country, you may still be able to hire someone for, $12, $15, $16. So that's going to be a difference with where you're at in the country, as well as cost of living where you're at. And so the rates for virtual assistants can vary. There's some pretty low rates if you go to hire people on your own. That just seemed like, like $3 an hour, which just seemed like mind boggling, right? I was like, I can't imagine paying someone that. But I would say reasonable to think that a virtual assistant is going to be somewhere between $8 to $12 an hour is sort of pretty standard. If you have someone who's really highly skilled doing a special thing like billing or maybe, something higher level, it may be higher than that. And one thing I like to point out here, because it could sound like, oh, I just don't want to pay local employees as much, is, our rates have not gone up in insurance-based medicine. And so what this allowed me to do is pay my in-office staff more. So my medical assistants make more than twice as much as when I started my practice 10 years ago. I have a well-paid office manager now. And so I could have, 5 or 6 in-person employees that I pay less, or I could have my 3 in-person employees that are paid well, have good benefits, are not overworked, are happy with their job, and offsetting some of that to people who are also well paid for their standard of living, where they're at in the world. And so that, has been something I've been comfortable with. I really think that I'm a better employer for my people who I do have in my local area. Even if I have less employees, the employees I have are getting paid better and have better benefits than they did in the past. But I think that is like an ethical thing that some people would like to explore when they're considering virtual assistants is, do you have a duty to your own community? And those are personal ethical decisions I think that one might make.
Well, thank you for that. Any parting words for our listeners, who are thinking about adopting?
Yeah, I would recommend starting with, an agency that has experience in doing this. There are many, many out there now. Again, start with small tasks until you feel comfortable. And then just like any employee, it's your job to train them. And so make sure you have done the appropriate training. And if they're not meeting your expectations, then reassess if the training was good. And if it truly isn't a good fit, then that's okay. Find someone else. But there are lots of wonderful virtual assistants out there that will make your practice much more efficient, make you happier, and make your patients happier.
Well, thank you, Dr. Francavilla, for such a wonderful conversation today. And I'd like to thank our audience members for attending today. If you have any other questions, feel free to chat with us on the discussion board that is on this platform. And there are a ton of resources out there as well as Dr. Francavilla's presentation, pre-recorded webinar on this subject as well that's in the resources section. So thanks all for coming to listen today, and have a great rest of your day.